Are you struggling to get suitable cases for your RCA? Then you've clicked on the right video. This week I was on a coaching call with a GP registrar who's planning to submit for the RCA this November. And one of the issues that she had was that she was not getting the right cases. She was getting follow-up cases. She was getting cases that were not suitable for the RCA. This is a common problem that GP registrars face in the practice. And this is a problem I also encountered when I was sitting the RCA not too long ago. So in this video, I'm going to show you how you can set your clinic up so that you maximize suitable RCA cases. If you're new to this channel, hi, my name is Dr. Erwin Kwun. I help doctors lead a happier and more fulfilling life. Every Thursday, I publish a new video. If you don't want to miss any future videos, make sure you subscribe and turn on notifications so that you're notified first each time I publish a new video. How your clinic is set up will play an important part as to whether you're going to pass or not, because the RCA is an exam that you take in your practice, and think of it as if you're arranging your own examination. So you need to select the right suitable cases so that you show evidence that you can practice as a safe and independent GP. So it's very important to get your practice on board from the start. Let your practice manager know that you're going to sit the RCA. Let them know that you need the support of the practice. Speak with your educational supervisor and have a strategy as to how you're going to capture these cases. It's important that you plan how your clinic is set up. So have a discussion with your educational supervisor. It's very important to think about what are the steps that you're going to implement if you're struggling to get cases as the date of the submission is approaching. Let me tell you what worked for me. What I did was I spoke with the other GPs and the practice manager as to when I'm going to sit the RCA. So at one of our educational meeting, I did a small presentation of the RCA and let the GPs know what sort of cases that I'm looking for and what cases that would not be suitable for the RCA. By making a presentation about the RCA, then I informed the team about me sitting the exam and what were the cases that would be suitable. And I explained to them that I would need their help and really appreciate that if I'm looking for such cases and if they find any cases on their list, then to allocate them to me. So this way the team was aware about what are the cases that would be suitable for the RCA. I also designed a list of cases that might be suitable for the RCA so that when the GPs are working, they can see that list in the room. Then it can remind them that this person is looking for these cases and they might be able to send these cases my way. So you can download the list down below. I suggest you print it and use it in your practice so that your team is aware about what sort of cases you're looking for. Another strategy I'd say would be useful is that you can decide that on this week I'm going to focus on cardiovascular. Then let the GPs know that if there's any cases of palpitation, chest pain, any cases that might be suitable for the RCA, then to book them on your list. This way, you'll be doing a lot of cardiovascular cases on that week, and you'll be more slick at assessing, consulting, and managing cardiovascular cases. Then once you've captured a few cardiovascular cases, then you can review them and select the best one. On the next week, then you can follow on a different topic in the curriculum. By focusing on a topic of the curriculum in a week, then you'll be more slick at assessing that problem. And because you've been doing it many times, then it's more likely that you'll be more slick and it increases your chance of getting the right case for the RCA for that topic. So then you can move on to another topic the next week. This is how I would recommend you do it if you find that you're struggling with clinical management and not sure about the management. Because if you've been doing a lot of cases in that week related to cardiovascular, then it's going to come more naturally to you. Another aspect of your clinic is to look at how many slots have you got in a session. It's very important that you discuss with your educational supervisor how many slots that would work for you. If you find that you're struggling because of the workload, this is something that I would recommend that you discuss with your educational supervisor, because part of the training is to pass the RCA and the practice will support you. If you're struggling, you need to actually let the practice know and discuss this, because it's very important that you don't let the workload pressure to compromise your chances of passing the RCA. So it needs to be a balance. So if you need to have catch-up slot, discuss with your educational supervisor. If you use eConsult or Ask My GP in your practice, then it's important to see whether your educational supervisor would support you to get access to the requests in the morning so that you can actually book your own clinic with the suitable cases yourself. By doing that, you have more control as to the cases that you're booking on your clinic, and you're a better person to decide as to whether this would be RCA suitable or not. So this will help you to get more cases if you're finding yourself to struggle to get suitable cases. You might find that other people in the practice are busy and have other priorities. And because the RCA is your exam, it's very important that you take it on yourself to take the ownership of this exam and make sure that you're getting the right cases. If you're needing help, then discuss with your educational supervisor and see how things are working. If things are not working well, then there might be some changes that you and your educational supervisor might need to make. So it's something that you have time to actually work on. If the system or the clinic is not working, then tweak it and change it and see what works. And then if it's still not working, then make other changes. So the way you can do it is, as the day of the submission is approaching, then you might need to have more control over your clinic. You might need to see whether you might have to come earlier and book patients and see what's on the other GP's list, and then see whether they'll be suitable for you. So this is the things that's very important that you do if you're struggling with your RCA. The other thing you can do is that if you have educational session, for example, half-day release, or if you have your SDL, then you can open this session to actually record for your RCA. You can use this session as clinical session. Once you have completed your RCA recording, then you can have these study sessions back. So it's important that actually you discuss with your rota coordinator to look at how you can actually make sure that educational sessions are being used so that you can maximize your patient recording for the RCA. I know some GP registrars who are working less than full time might feel that they have less chance of recording for the RCA, but it's something that you can still do. I did the RCA as a less than full-time trainee, and it's actually not a bad thing, because when you're full-time and you're recording every day, then you can find that it's very hard on yourself and can easily burn out. Whereas if you're doing it less than full-time, you have time to rest and you have time to actually think about what you're doing with your RCA preparation. Whereas if you're doing it every day, it can be very exhausting. So it's very important to balance the workload and RCA recording. If you have any struggle, then discuss it with your educational supervisor. Look at what other colleagues are doing as well in the practice and see how you can actually implement things that might work, and see what doesn't work, and see how you can improve your clinic setup over time. Your receptionist is probably going to be your best friend in the RCA. So make sure that you speak with your receptionist, let them know what suitable cases are for the RCA. And if you're doing on-call in your practice, then it might be a good idea actually to filter the on-call requests while they're coming through. And if you need to book them on your clinic, and you can get your acute case that way. If there are any tips that you can think of that I've not mentioned in this video, then I'd recommend that you write it down in the comment section. Share your tips how you're getting the right cases for the RCA. If you found this video useful, then I've got another video I'm sure you're going to get a lot of value from. This is a video where I interviewed Dr. Caroline Asher, who recently passed her RCA first attempt. We discussed her process, her approach to the RCA, what she wished she knew, what she'd done differently, and you get a lot from this interview. Click on the video to watch it, and if you'd like to have the RCA blueprint, then click on the link down in the description below. Take care everybody, bye bye.